Hi, I'm Dr. Vikas Sayed. I'm a radiation oncologist. I'm sure many of you have heard about what oncology is about. I would like to spend a few moments explaining to you what the big C, what we call cancer, is all about. Cancer is a group of diseases, otherwise called malignancies, which affect different age groups, different communities with different etiology and causes which are known and which are also unknown. India as a country, we generate almost 1 million new cases every year. And that's a large number for a developing country like India, which has limited resources and huge expertise required. Cancer as a disease is challenging India in many ways, in clinical ways, socioeconomic ways, and epidemiologically. Let me tell you about a few things about cancer, especially in the suburban and rural areas. Cancer is not easily detectable. This is why we embark upon community outreach programs. It is very imminent that we educate, motivate, and screen risky populations who have apparently history of cancer in their families or use of tobacco, especially in head and neck cancers. Among women, breast cancer and cervical cancer are very common in India. Yes, there are technologies, there are a lot of expertise in India, but the problem in our country is we don't have access, we don't have facilities which are comprehensive. When we say comprehensive cancer care facilities, we mean technologies like radiation oncology. This is what we call a radiation therapy linear accelerator. A radiation therapy linear accelerator is 60% and 70% of the times required to treat all cancer patients, regardless of whether they're breast cancers, head and neck cancers, colorectal cancers, or even brain tumors. India has less than 400 such teletherapy machines, of which half of the machines are cobalt machines. Now, cobalt machines are unfortunately outdated because we use cobalt-60 as an isotope which is not recommended in today's modern radiation therapy times. This radiation therapy linear accelerator is very effective in treating cancers and reducing the chances of spread, and also providing effective cure for all patients, especially solid tumors. From the last 15 years, we have developed a very comprehensive network of cancer centers called Pinnacle Cancer Centers India. This integrated group of comprehensive cancer centers are spread across the country. We started in Hyderabad almost 25 years ago. We came to Bangalore, established a super specialty cancer institute. We went to Chandigarh, established a great cancer institute, and we went on to Trivandrum. Now, Pinnacle Cancer Centers India is a robust group of many radiation oncologists, surgical oncologists, and medical oncologists who form the pilot group called the Super Oncology Group. This Super Oncology Group is the oversight pilot group which looks at the spread out of the network of cancer centers in major metropolitan cities and suburban cities. We look at Pinnacle Cancer Centers Network as the fastest growing, largest network of comprehensive facilities which we would like to take to different geographies of India. Pinnacle Cancer Centers will engage with private institutions, with government institutions, with trust hospitals, as long as the platform makes sense and it is designed to cater to all types of cancer patients, regardless of their socioeconomic background. There is no patient who should be denied optimal cancer care, especially when the resources are available, and that is our objective. Our objective is to bring the resources closer to the communities, focus on community outreach programs, education, early screening programs, and ultimately we need to see that patients come in early stages, are cured, have a good cosmesis, and ultimately the patient goes home happy. At the same time, the cost factor would be a burden. A lot of people cannot afford cancer care in today's times with the exponential care. So there is a focus on health insurance. There are a lot of health insurance programs which promote cancer coverage also. So we would like to bring comprehensive solutions to people and communities closer to their localities, whether they're in the districts or the suburban areas or in the big cities. It is more needed out there. There are many hospitals available in the big cities, but we would like to take our network to the smaller places with the platforms which are accessible, which are easily available, cost-effective, and most important, we relate with the patients as a clinical group with compassion, with excellence in skills, and we understand what cancer is, and we're here to serve all of you. The big C is definitely a little scary if you think about it, but we are here with a lot of resources. We're bringing to the communities a lot of technical resources, clinical expertise to bring warmth, compassion, and cure with the excellence in skills to see that cancer is curable, it is not as scary as it sounds, and the big C will be conquered by all of us together.